Hi friends, I'm Dr. Chandrashekar, Medical Director and Chief Dermatologist at Cutis Academy of Cutaneous Sciences, Bangalore. I'm in front of you to talk about hair loss. Of course, hair is a crowning glory. Hair is so important for everyone for its social acceptance. A bald scalp will always be looked really in a bad way in the modern society. And a bald scalp in a female or a less hair in a female is so much embarrassing. So let us see what are the types of hair loss people have. So there are categories of hair loss. Of course, uh, there are three important hair loss which we should know. Number one is uh, alopecia areata, where you feel that there are rounds and rounds patches of alopecia, like this. What I show. So you get round patches of alopecia, then it progresses, then it becomes alopecia totalis, where you lose all the hairs from the scalp, and it becomes alopecia universalis, where you lose all the hair from every part of your body, including the eyebrows, beard, axilla, even the hair on the body will also be lost. So this is one type of hair loss. The second most important type of hair loss is chronic telogen effluvium, where a patient loses hair because of several reasons. I'll come to the reasons of hair loss later. Where you see in females, the side of the hair goes off, and you will see start thinning. You will see start seeing thinning in this area, thinning in the middle part, and overall the size of the ponytail and the part. I mean the density of the hair comes down. The third variety is very important, called androgenetic alopecia. I think this is the most commonest variety of hair loss we see across the globe. So this affects both men and women, and of course it can start from the age of nowadays we see even androgenetic alopecia occurring at the age of 12, 13 years also. But it's most common between probably age of 25 to 40. There are patients who are below the age of 25 too, and above the age of 40, 50 also. Similarly, in females also, we see this it probably in the middle age more. Maybe it starts by the age of 35, 40, and it can be go up to the age of 60 years. So this is a female pattern hair loss, what you see here. And doctor, how do you grade this alopecia? So when the treatment aspect comes into picture, the doctor has to know, the patient has to know what are the grades of alopecia, where the treatment depends on really the grade of alopecia. So this is how the grading is done in alopecia. So normally there are up to 8 grades in alopecia in men, and there are 3 grades alopecia in women. And you can see these alopecias are male alopecia. It simply starts at the age of around 18, 20 or 20, 25 with you losing hair from the corner. Then probably it goes little bit back and it becomes in the vertex area you lose hair. Then totally it goes as the stages goes like this, what I'm showing. So this will go to a grade 6 or 7 alopecia. Okay. In a female, the same thing. What happens is, of course, they start thinning in the center. Their partition would become more. The moment they are standing in front of the mirror, they would appreciate that there is a thinning of the hair, and their partition width becomes wide. So that's an indication of a female pattern hair loss. Of course, they can also think about losing hair from the sides and all those things. So this is a pattern hair loss, which is very common. So till I told you about treat various types of alopecia. What is the reason for it, doctor? That is a question which everyone asks. When it comes to alopecia areata, it's an immunological disease where there are autoantibodies produced against your own hair cells, and these autoantibodies destroy the hair follicle. Of course, it can be hereditary. There are so many factors which can initiate, which can perpetuate alopecia areata. When it comes to chronic telogen effluvium, the most commonest cause. See, chronic telogen effluvium is something like a general hair loss. You see general thinning on the scalp. The most commonest cause for chronic telogen effluvium could be a stress related. It can be a nutrition deficiency. It can be some other diseases chronic diseases or acute febrile diseases like typhoid fever, malaria, dengue fever, of course, the COVID-19. So these things can induce hair loss over a period of time, and these are called acute telogen effluvium, where you see an acute hair loss once you are recovering from the infection. Maybe 6 weeks after the typhoid or a malaria or a COVID infection, probably you start losing your hair. It's called telogen effluvium. And similarly, some of the medicines you take. See, once we are all 35, 40 years of age, so we have a tendency to have anti-diabetic drugs, anti-hypertensive drugs, anti-epileptic drugs, so many and so on, anti-arthritic drugs, all these things. So these are some of the drugs which can cause hair loss. So when you visit your dermatologist, probably the dermatologist would look into all these factors why you have a hair loss. And when it comes to a most commonest cause of hair loss, pattern baldness, where males and females become bald as they age. But now we see that happening in a very, very short, early period of time. This pattern hair loss, normally it's hereditary. If both parents are affected, probably it goes to an extent of 40% where the hereditary familial hair loss can occur, or it can start on its own as something like a mutation. First time you would be the first person who is becoming bald in your family. So that goes like that. Even in female pattern also it happens. But especially when we talk about female pattern hair loss, there are a lot of other things which happen. It's not only hereditary, but a female who is having a polycystic ovarian disease, or a female who has got a hormonal abnormalities, if there is a male hormone overactivity in the female, it's like in the form of having hirsutism, like an unwanted hair growth on the face, and acne, seborrhea, and even people who are obese, like pseudoacanthus, you have a black neck, and all your body folds become black. So this is called insulin resistance or a metabolic syndrome. When we examine the skin and hair, we come to know about it. These kind of reasons come in female pattern hair loss. So till now, I told you what is hair loss, what are the types of hair loss. And let us see if, what about the treatment for hair loss, doctor? Yes, treatment is very much available. Previously, maybe yesteryears, if you talk about a decade back, when you are becoming bald, doctors used to say, no, we can't do anything. It's your nature of becoming bald. It's your destiny to become bald. You cannot do anything much about it. But now the scenario is entirely changed. So how do you get treated yourself? So in a baldness, probably early baldness, what I showed that level of baldness, the grades of baldness. So you can go to your dermatologist, nearby dermatologist. They would really classify you to which grade of baldness you are in. Accordingly, they would treat you with topical medications, oral medications. See, universally, there are two medications which are used for pattern baldness. One is topical minoxidil and oral finasteride. The doctor would be able to tell you what is the line of treatment you need to undergo. I just tell you, after using these kind of medicines, this is the kind of improvement you develop. See, you can see the improvement of male pattern baldness just with the topical medications here. Then you can see here again improvement in the topical. You can see a wonderful hair growth which happens. You can also see the next photograph. You can see the improvement in the sides of the scalp, and of course it can happen also in female. Once you feel that your doctor is not in a position, or treatment given by the doctor is not helping you much, you are not growing the hair, then we have hair transplant. I think it's one of the most gratifying cutaneous surgeries is hair transplant, where you can see a real wonderful result with the transplant. To show this, I will show you a photograph where the hair transplantation is done in the advanced hair. So you can see the improvement here, and even in the hair transplantation where we create hairline. Suppose somebody is bald here, we create hairline. This is a hair transplantation results what I'm showing you, and this is again creating a frontal hairline. This is the hair transplantation picture, and similarly, this happens in male. So in females, of course, we have same medical line of treatment like topical minoxidil and oral finasteride. Oral hormone anti-hormone therapies are there, and in a female, suppose if it is, how does it work? It works on hormones. It works on hair growth stimulation, and these are some of the photographs which tell that there is improvement in the hair loss as far as treatment is concerned. This is again female pattern hair loss which is treated medically, and you can see the results. And of course, in case nothing is working on the scalp for females also. Doctor, do we have a method of hair transplant for them? Yes, this is one of the photograph where we have done the hair transplant. You can see it's very good for females also. And this is again a female pattern hair loss which was not relieved, which was not treated with medical line of treatment. We have done hair transplant. This is that is again constructing a hairline. Some females can have a hair loss and their hairline would go back, and we can construct the hairline like this. This is one of the ways of hair transplant in female. Okay, I'm talking about a pattern baldness now. So I told you what are the reasons for it and how do you treat medically. And in case if the medical line of treatment is not going to work for you, how the hair transplantation is done. So in a telogen, what you told you as a general hair loss, probably we give peptides in the form of serums on the scalp to grow. Oral nutrition will we give to grow the hair, and of course we try to identify the cause why you have hair loss. Similarly, when you go for a these are some of the photographs what I am showing you, how the improvement comes, and you can see this thing. And when it comes to alopecia areata, I was talking about a male pattern baldness, then telogen effluvium. Now I'm telling you, in alopecia areata also, there are lots of varieties of treatment which come. So we give topical therapy, we give, most of the time, we if there are patches are only about 2 or 3, we give steroid injections topically, which grows the well very well. 85% of the time, the patients do extremely well in alopecia areata. In case if they are of high grade alopecia, like this or like this, then probably we give oral immunosuppressants, and we have new medications which can come for treatment of alopecia areata. Like we have drugs like JAK2 inhibitors, we have drugs like steroids or immunosuppressants like methotrexate, all these things. Probably the doctor would judge what is the line of treatment which has to be given when rapidly you are losing hair in alopecia areata. So this is about common types of hair loss and how they are probably diagnosed or graded and treated. In general, see, we know now the reasons of hair loss. So how do you going to prevent hair loss? Probably the one of the most commonest reason for a generalized hair loss is stress. You need to have a stress-free life, or if you have a stress, you will have to lessen it down by the advice of either by the doctors or by meditation. Then the nutrition is very important here. See, remember the most two organs of the body have got a metabolically very active. The most metabolically active organs in the body are two. One is bone marrow to produce blood. The second one is the dermal papilla to produce hair. So when they are metabolically so active, they need a good nutrition. So you will have to have a good nutrition in the form of a high protein rich diet and in form of multi minerals, especially hair food like millets, like sprouts, then pomegranate fruit, apple, then green leaves to have iron. So all these things are very important to grow the hair. So your nutrition is second. Then you need to modify your lifestyle. There are the factors which contribute to hair loss as far as lifestyle is concerned is number one, smoking, and number two, drinking and without exercise. So you need to fit your body and your mind to have a good lustrous hair on your scalp. Then, of course, once your treatment is started, you need to have a regular follow-up with the doctors. You just cannot complacent, you cannot sit, because once you start a male pattern baldness treated, that is pattern baldness treatment, you are committed to lifetime, because you know that it's a genetic disease. It is going to just go on becoming bald. So once you start your treatment, you will have to get committed to your treatment. You need to continue treatment. How long to continue treatment in pattern hair loss, in a general baldness? So you have to continue treatment as long as you want hair. It can be 5 years, it can be 10 years, it can be 20 years. So commitment to the treatment and your regular follow-up with the doctor or a dermatologist is very important as far as hair therapy is concerned. You will be so happy to see your hair grow within a matter of 4 to 6 months, but you should know that if you stop your treatment, probably you will come to the original state of baldness. Additionally, whatever you are going to lose in another 2 years would also shown up on the scalp. So my message to you is that Do not neglect hair loss because hair is a crowning glory. Whatever may be the type of hair loss, please go to a nearby dermatologist and seek their advice. Once you seek their advice, follow the treatment. Once you are following the treatment, do not default. You have to follow the treatment. If it is a telogen effluvium, alopecia areata, probably the treatment duration would be less. But if it is an androgenetic alopecia, male pattern baldness, like what we commonly go bald, you have to have a commitment for lifetime. So thank you very much, and I hope this will be useful, and probably you will follow the instructions what I have given in case if I have a hair loss. Thank you very much.